Rheumatoid arthritis is a condition where the immune system attacks our own joints. There are many challenges of living with rheumatoid arthritis, and these can impact a person's everyday life in a major way.
The day-to-day challenges of having RA, the pain is the biggest one, fatigue, the limits on my mobility and my independence.
Work has been a big issue. I was working full-time, commuting to the office, an hour drive there, an hour drive back, but now I have to work from home and have done prior to COVID.
One of the worst of those day-to-day challenges was that you feel rather as if you've got low-grade flu nearly all the time.
The scale of challenges faced by people living with RA today is huge, but also very varied. There are relatively few people, I think, who are in sustained remission. So most people live with differing levels of pain, fatigue, disability. We're seeing people who are less damaged than people like myself who've been diagnosed a long time and have got a lot of damage.
Physical activity is one of the things that's recommended to help people living with rheumatoid arthritis manage their symptoms and reduce their risk of developing other health problems such as heart disease. However, we know that despite the fact that many people living with rheumatoid arthritis want to be more active, they can face many barriers when it comes to engaging in physical activity.
My knees got so bad when my RA kicked off, I couldn't even walk those 500 yards to get to the gym. So I stopped going, and in turn that meant my physical fitness became even less. So then when I did start going back, I found it much harder to be on the tread machines like the walkers and the cycle, and so I stopped going altogether.
I avoid things that involve hard impact, hammering things or digging or anything of that sort. I gave up playing tennis when I was quite young because my wrists and my elbows would complain every time I hit a ball.
One of the myths, if you like, that persists amongst the RA population is this fallacy that doing exercise or moving is going to hurt your joints. There is extensive research now that shows that exercise and strengthening exercise, cardiovascular exercise, is actually very beneficial for people with rheumatoid arthritis.
Mission RA is a research study that aims to help develop a more personalised way to help people living with rheumatoid arthritis be more physically active. The emphasis of Mission RA is on supporting people just to try and move a little bit more, and this means providing support to do any movement they feel that they can do and that they want to do. And this could be just standing a little bit more, to walking or gardening, or just being more mobile around the house, or even doing exercises like cycling or swimming. And to provide this support, the Mission RA study will develop a mobile health app, and this app will be linked to a popular activity tracker, the Fitbit, and it will use artificial intelligence to provide personalised support for physical activity. When a person uses the Mission RA app, the app and the Fitbit will work together to automatically learn about the person's physical activity patterns. The Mission RA app will also ask the user to record their preferences for physical activity. And this will help to build an activity profile for that person, which is based on the types of activity that they already do, as well as what they enjoy doing or may want to try. And using this information, the Mission RA app will then employ artificial intelligence to provide daily, personalised feedback and support the user to increase their physical activity. The Mission RA app will also be developed in partnership with people living with rheumatoid arthritis to ensure it's engaging, accessible and really motivating.
I think it would be really helpful on two counts to have a more tailored support. One is, at the minute you feel like a number, everyone's the same, 100 people, 1,000 people, we're all the same, but we're not. So if it was more tailored to an individual person, i.e. me, I think I would feel more motivated because I know it's tailored to me and it's going to help me and help my needs.
Having a bit more personalised support tailored to people with RA is a really good thing, to feel more inclusive, and I think it's just that encouragement as well.
I think the aims of Mission RA are critically important, and even if you can't get somebody to start doing formal exercise, getting them to just be physically more active around the house and moving more, getting up and down more, sitting for less hours.
We're looking for over 300 people living with rheumatoid arthritis to take part in Mission RA and to help us develop and test the Mission RA app. There are lots of different ways to be involved, from wearing activity trackers, which will help us develop our artificial intelligence algorithms, to taking part in interviews and workshops to develop the app, and also then testing the app. If you are interested in getting involved, please email us and we can provide you with some more information.